Welcome back to the MRHA podcast. This is our third episode, and we continue to have great guests on. And today I have Suzanne on, Deputy Director for Development from the Maryland Citizens Health Initiative Education Fund. Welcome, Suzanne.
Hi, Jonathan. Thanks for having me on.
Can you tell us a little bit about yourself and just a little bit of background of your organization that you're representing?
Sure. First and foremost, I am a native of rural Western Maryland, in Garrett County, where I am right now, in my parents' home recording. But I came to the Central Maryland for school. I got my master's in social work from University of Maryland and my master's of public health from Johns Hopkins. And during that time, I interned with the Maryland Health Connection. The Maryland Healthcare for All Coalition, and really got to get my feet wet in the advocacy world. And through working with the Maryland Rural Health Association, have been able to combine both my passion for supporting rural Maryland and advancing access to quality, affordable healthcare. So I've been part of the legislative committee that MRHA convenes, and have really learned a lot from everyone in that's involved in the MRHA network, and I'm just honored to be a part of it.
That's fantastic. And so you're up my way. So I'm in Allegheny County recording this, and you're in Garrett County. So we're very close, which is good.
Yeah, it's a beautiful day out here.
It is a beautiful day. I'm looking out my window right now, and it is beautiful and gorgeous. And so you mentioned the legislative committee of MRHA. And so first, I'd like to thank you for serving as chair our previous year, leading that committee. Can you give me a little bit of background of your coalition, though? A little bit about the history of the coalition.
Yeah, sure. So we are the Maryland Healthcare for All Coalition. We were founded in 1999. By then Health Commissioner Dr. Peter Bielenson, who has gone on to do many different things. But what really motivated him and many other diverse stakeholders to come together and form this coalition was they found that they were repeatedly going back to ask for more and more little pieces of the pie for cancer screenings or other prevention funding that could, if everyone had access to quality, affordable health insurance, they wouldn't necessarily need to, go back all of the human capital and other capital that was going into these asks could have been more easily used effectively if everyone had healthcare. So in 1999, he came together with hundreds of organizations from across the state that represent faith, business, labor, providers, community groups, hospitals, insurers. We are really blessed to have such a great network within our coalition. And, more than 20 years later, we have a lot to show for our work. When we were founded, the state's uninsured rate was around 13%, and it's less than half that now, around 6%, with some of the largest increases in coverage occurring in rural areas, which I think we can be really proud of. So we're proud to be the state's largest and most diverse coalition of healthcare consumers working on this issue, and have really gained a lot of ground. We're not there. We haven't achieved full coverage yet, which is our goal. And we're really doubling down on that in the year ahead, which I'm looking forward to talking with you a little bit more on this podcast.
Of course, health insurance and coverage for all of Maryland, but for rural areas is a significant challenge. My previous role working with health insurance navigators to navigate the exchange was part of what I did. Can you give me a little bit of background, though, on your specific role at the coalition?
Sure. So Vinny DeMarco is our president. You often hear him in the news. My role is to keep the home fires burning, really. I work in our office, which is based in Baltimore, and really what I like about my role is I help to build relationships with our coalition partners and just understand what they're hearing, what they're experiencing as they're trying to access healthcare in Maryland, and help to navigate in any way that I can to connect them with other people if there is a need, as well as funnel that feedback back into our advocacy. So I have a wonderful wonderful group of coworkers. Stephanie Clapper, you may see a lot on the different work groups that Maryland Health Benefit Exchange and the CHRC and others host, as well as Reverend Sandra Connor and Catherine Kirk Robbins.
Very good. That's fantastic. And again, I applaud you on the work that you're doing. And, we mentioned before a little bit about that legislative aspect of the coalition. And in Maryland, if people's not aware, the General Assembly, our legislators meet for 3 months out of the year. So usually from January to March is when they meet to discuss bills and pass legislation. And so, however, we're in the summer months, we still actively plan for 2023. So can you tell me a little bit about some of the priorities that the coalition is going to be focusing on next session?
Yeah. And while I was thinking about this podcast, it really blew me away to think of all the ways that we have worked with MRHA in the past that, are because of the great work that was done, this foundation that was established, we are in an even much better place going into next legislative session. So one example of that is the health enterprise zones, which was way back in 2011. It was a healthcare expansion that was funded by an increase in the alcohol excise tax. And it basically piloted this idea that if we gave tax incentives or grants to localities that knew what their challenges were, each locality is so unique and so different. What if we really gave a lot of that freedom to those different localities to figure out what those needs are and how to best address them given their challenges and resources in each place. And what they found from that pilot of the health enterprise zones was that it really made a huge difference, particularly in health disparities and access to care. So much so that the state revived the health enterprise zone model in 2021 with the Maryland Health Equity Resource Communities Initiative, which MRHA supported, that our coalition championed. And that's resulted in $59 million in state investment based in really helping to remove barriers to care and those disparities that are causing differences in health outcomes. So the first round of that act has already been awarded in the Pathways to Health Equity grants, which were about $13 million to 9 different grantees across the state. And we're very excited to hear that work beginning. But we've also worked with MRHA on just enrollment. And I understand that David Stewart was on your last podcast, and he did a great job talking about the needs and all of the great resources that they're now setting up, storefronts in Hagerstown and other places, just because there are so many people who are eligible for coverage, but they don't know where to begin to get enrolled or what the coverage would really mean for them and their families if they've never had coverage before. So David and his team really even date back to 2013 when the state was first looking at implementing the Affordable Care Act. Particularly Western Maryland was in a really unique position because in that region, we had the state-based exchange model in Maryland, a partnership exchange, and a federal exchange between West Virginia and Pennsylvania. And these navigators had to be experts on all of those models. And, I'm not sure that we found any other region across the country that had those same challenges that Western Maryland was able to overcome. With what we established with MRHA and the Healthcare for All Coalition was the Rural Area Enrollment Network, which is now, rolled into Western Maryland AHEC and all of the great work that they're doing. So I think it's just really cool to see how these great things that we worked on back then are, blossoming today. We talk about some of the work that we have coming up and how this last legislative session was such a great session for healthcare. What we are looking to do is to continue to build on that we've released a Healthcare for All resolution back in May, where we're asking organizations from across the state to endorse this concept, which would do 3 different things. And if fully implemented, the state would achieve near universal healthcare coverage. The first being auto enrollment of people who are eligible for Medicaid. In David's podcast, he talked about how anyone who's eligible for Medicaid can enroll any time of year, and how they're trying to build on that and make that easier for people. Because if you're in a crisis and you need healthcare, you can't just wait until open enrollment. And that's something that we think the state can expand on, especially with our easy enrollment health program, which allows people to just check a box on their state health insurance, their state income tax forms to initiate the enrollment process. How can we speed that up? How can we remove barriers to help people get into coverage and use the wonderful resources like what Western Maryland AHEC offers, and many others across the state offer, as quickly and as efficiently as possible? So that's one of the three pieces. The second piece that we're asking the state to do would be to increase subsidies for individuals and maybe small businesses, just to make the coverage even more affordable. The state piloted something similar to that with low-income young adults this past session, or open enrollment period, and found a huge benefit from that. And part of that boost was additional funding from ARPA, from the federal government, that provided more subsidies for everyone who are in a certain eligibility category. And we're hopeful that those will be made permanent, but await the decision from Congress, the U.S. Senate on that. And then the third and final piece of our Healthcare for All resolution that we're seeking endorsements for would be removing immigration status as a barrier. As we saw in this last session, CASA really took the lead, and many of MRHA's members supported the Healthy Babies Equity Act, and that called for the state to apply to CMS for a waiver to allow anyone who's income eligible and otherwise eligible for Medicaid, who's pregnant, to apply and enroll in Medicaid for themselves and their children. And that's a great step in the right direction. We're a little surprised and frustrated at the delays in implementing that. But we think that there can be a lot more that the state can do just to remove some of these things that have been put up as kind of artificial barriers, because we know if you need healthcare, you need healthcare. Your immigration status shouldn't have anything to do with that. And so we've been doing this outreach to get more organizations to sign this resolution. Since May, we got 110 groups, and we're still working on that. So if anyone's listening to this podcast and is interested in signing on, the website would be www.healthcareforall.com/resolution.
That's fantastic. And the work that you're doing is absolutely amazing. And I myself need to take a look and see that resolution and read over that, because I was kind of unaware of that. So I'm glad that you mentioned that during the podcast. I'm also glad you mentioned health equity. Health equity definitely was a priority. The health enterprise zones, of course, back in the day, and now kind of revived that type of model. And so I understand some of the work that they're doing with the Pathways grants, actually serving on one of the advisory committees for HERC. I've got to be actively involved in some of that work. And you mentioned going to the website. So is there any other way that individuals listening can get involved in the work that you're doing and help try to advance that needle?
Yeah, well, I, of course, as a former chair of the legislative committee, I would strongly recommend anyone listening to this podcast who's part of MRHA to join the legislative committee. It's a great group of people who are just checking in throughout the legislative session, like you're saying, to keep your finger on the pulse of what's going on. There are many different interests represented in the legislative committee, and it gives you a broad sense of where different stakeholders are on the key pieces of legislation that the Maryland General Assembly is considering, and opportunities to weigh in on those, and opportunities to share and ask questions of different stakeholders on where the legislation is and kind of the rationale behind it, and what some of those pitfalls or unintended consequences might be, how a different piece of legislation could be stronger. So I've really gotten a lot out of my participation in the committee and highly recommend it. Another piece, if you're interested in the Healthcare for All resolution, is to sign up for our emails. We don't inundate people. It's just, relevant information in a timely manner. And we also are on social media with Facebook and Twitter. And if there's anyone who wants to volunteer or have other specific questions, they can always reach out to me directly at Suzanne at healthcareforall.com.
thank you, Suzanne, for being on the podcast and really giving us a great overview of the priorities that the Healthcare Coalition is working on and some of the previous partnerships with MRHA and, some of those priorities that we are going to be focusing on for 2023's Legislative Assembly General Session. So again, thank you. If you want to find more about what Suzanne is working on, you can go to healthcareforall.com to look at their resolution. They also have social media as well, so check them out. And again, I want to thank Suzanne for not only chairing legislative committee last year, but so in rural Marylanders. So thank you.
Thank you so much, Jonathan. This was a pleasure, and I always love working with MRHA. So thank you so much for all that you do.